the cardio means heart. Okay, cardio means heart, and vascular means blood vessels. So cardio means heart. You know, cardio means heart. Vascular means vessels, blood vessels. So all whatever you see in the screen, these blood vessels and the heart together we call it the cardiovascular system. So let me introduce to the heart today. So when we say heart, we know heart has 4 chambers. It has 4 chambers. It has 4 chambers. 1, 2, 3, 4. Okay. So we can divide it into right side of the heart. This is the right side of the heart, right heart, and this is the left side of the heart. Or what are the 4 chambers? The 4 chambers are right atrium, left atrium, okay, right ventricle, and left ventricle. So the heart is composed of 2 atrium and 2 ventricles. Right atrium, left ventricle, left ventricle. Okay, we go with the right side of the. Okay, before we go to the right side and left side, let me tell you there are also some valves. We call them as valves. Okay, there are 4 valves located in the whole heart section. Okay, so number 1 valve. So valve is that thing that allow to go. And that allow only one side, one way. Okay, that's why we need a valve. Like we put air into the tires, they are valves, so that air can go only inside, not outside. So that kind of valve also present in the heart. There are 4 valves. Okay, so one valve is here, which has got 3, which is between the right atrium and right ventricle. Okay, one valve is here. Another valve is, okay, I can say here, from the right ventricle, the blood goes to the, where the blood goes, blood will go to the lungs. Blood will go to the lungs, okay? It will go to the, both the lungs. So there is also one valve here. Alright? And one valve is here. And another valve is here. So there are 4 valves. 1, 2, 3, 4. So first valve is present between the right atrium and the right ventricle. So this valve is called as, okay, I write here, it is called as tricuspid valve. Tricuspid valve. So because tri means 3, because this valve has 3 cusps, it has 3 cusps, so we call this tricuspid valve. So this tricuspid valve allow the blood from right atrium to the right ventricle only, not from the backflow. If there is a backflow, it will be a great problem, big problem. We'll discuss it later. Okay. Then there is another valve that allows the blood flow from right ventricle to the lungs. Okay. These are the, let's say these are the 2 lungs. Okay, they don't look like lungs, wait. So there is another valve here, number 2. So number 2 valve is letting the blood going out of right ventricle to the lungs. This is called as pulmonary valve. Pulmonary means lungs. Pulmonary valve. Okay. The third valve is between the left atrium and the left ventricle. That is number 3. That is mitral valve. Mitral valve. And the 4th valve is when blood goes out of the left ventricle, okay, to the aorta. We call it aortic valve. So you have to remember these 4 names. It's not so difficult. It's just like remembering 4 names of your 4 friends. So not much difficult. Okay. So starting from here. Tricuspid valve, pulmonary valve, mitral valve, aortic valve. 4 valves. Okay. So let's discuss the right side of the heart today. First we will start with the right side and left side, because they both have different functions. Right? Okay, let me draw this right side. Okay. Okay, let me cut this part. Okay. we will only do the right side of the. Okay, then we will combine the right side and the left side. So right side of the heart is composed of right atrium and right ventricle. It's very simple. As the name suggests, right atrium and left ventricle. And now we go with the right atrium first. In the right atrium, there are two openings. Remember, there are two openings in the right atrium. Blood comes from the upper half of the body. Blood comes from the upper half of the body. This is head, neck, and brain. To this right atrium, that is called superior vena cava. It is a big vein. Blood comes here. And blood comes from the lower part of the body. That is called inferior vena cava. So right atrium collects the blood from two sources. It collects the blood from two sources. From the superior vena cava. Okay, from the superior, So from the right atrium collects the blood from two sources. Superior vena cava, which drains the blood from all the, so this is the, from the face, head, neck, from above the heart level. So this is, here is the heart. So all this blood coming from here, from the venous blood, we are calling the venous blood. Okay, means the blood which have carbon dioxide. So from here, all the carbon dioxide containing deoxygenated blood, they will collect and they will go to the superior vena cava and drain into the right atrium. Okay. The inferior vena cava, it collects the blood from the lower part of the heart. From the lower portion of the heart, means from the lower half of the body, whatever the deoxygenated blood, means blood is carrying, means this blue part. Okay, you see the blue in the screen, you can see there's this bluish part. That is the venous blood. So that goes to the inferior vena cava. So it collects the blood from all the distant part of the body. Okay, like so. From all the distant part of from the lower limbs, from the abdomen. Okay, it joins and collects, and it drains into the right atrium. Okay. The point to be noted here, why I am telling you this part, okay, point to be noted here, look here. Right atrium collects blood from the head, neck, all the brain, from the superior vena cava and draining into the right atrium, right. This is not a problem because head is above the heart. So blood is coming without any gravity. But here, blood, this carbon dioxide containing blood, that is the deoxygenated blood, is going all around uphill, okay, uphill against the gravity, going and dumping into the right atrium. That is a problem. Why this is a problem, I am telling you. Okay. So let's say this. Now what is the function of right atrium, or what is the function of the heart? Basically, heart is a pump. When the blood comes, it pumps out from, so each of the ventricle or each of the atrium, each of the compartment has a responsibility that when the blood comes, it has to pump out. That is the role of the heart, nothing else. Heart just receive the blood and throw it. Receive the blood and throw it. Okay. So now right atrium, the right atrium responsibility is to put the blood, whatever the blood collects here, its responsibility is to push the blood to the right ventricle. Similar way, right ventricle will push the blood towards the lungs so that oxygen can be collected here. Alright. Now let's say this right half of the heart, this right heart has got some problem. Okay, we will not discuss the causes today. What is the problem? But let's say the right heart, with increasing age or with some disease, the heart is not able to pump with a force. We need a proper force. Heart need to pump with a force so that blood ejects out. If the heart with increasing age, like my heart and your heart will have a difference because I am aged than you, and my heart and a 60-year-old person heart will be different because his heart is little bit weak in comparison to me. In same way, my heart will be comparatively weaker than your heart. So because it needs a force, the heart need to contract with a force so that blood can be ejected out. So let's assume a 60-year-old man, his heart is not able to pump all of the blood into the lungs. Means he's not able to empty the heart right side. We are dealing with the right side. He's not able to empty the right side of the heart into the lungs. Now what will happen? That is called a heart failure. We call it as a heart failure when heart is not pumping well. Normally if heart should pump like this, heart is pumping in a weaker motion and slower. Okay. So what will happen? Okay. Nothing will happen this side because blood is coming from the head and neck, brain, from the neck freely. Again, without any resistance. But here blood has to move against the resistance. It has to move up, like from the ground floor to the top floor. So it needs some power here. Okay, it needs a force, it needs a pump here. Okay, the whole pump is provided by the back of the leg muscles. Okay, like if you touch the back of your leg, okay, if you touch the back of your leg, like, okay, so this is the knee joint. This is the knee joint here. Okay, this is the knee joint. Okay, knee joint from the back. Okay, from the back. So here so below the knee, you'll see there is a muscle. So this muscle below the knee on the back of your leg, if you touch it, you'll feel that the taut or tight muscle is there. We call the soleus muscle. That muscle, when we walk, that muscle contracts. That muscle contracts. Every time we walk, that muscle contracts. So what this muscle is doing? It's pumping the blood from here to here. It happens only when you walk. Okay, so every time you are walking, this muscle in the back of the leg, it's contracting. It's pushing the blood from here to here. That is one reason. Second, if in the aged or elderly person, the heart is not able to pump, what will happen? So in any case, due to any reasons, due to heart failure or due to some leg muscles or not contracting, whatever the reason, if the blood is not reaching the heart, heart is not able to dump the blood, heart is not able to empty the ventricles. We are talking right side, or blood is not able to reach. Now what will happen? So let's go with the first situation. Situation 1, when the heart is not able to pump. So heart is receiving blood, but it is not able to empty. So what will happen? There will be back pressure. The blood is constantly coming, but heart is not able to receive because already there is load of blood. Right? There is already lots of blood. So blood will now back pressure, back flow. Okay, it will back pressure with back flow. So now blood is constantly here. So what will happen to here in the legs? The plasma will go out. Plasma will go out of the blood. That means fluid will go out. So how his leg will be? So leg will be full of fluid. We call it edema or swelling. Edema of legs. So that means what? If a person has a swelling of leg, both the legs will be affected. Okay, if there is injury, it's a different story. If both the legs are swelling or there is edema, so what will you think? You will think about right side heart failure. When the right heart is failing to pump the blood out, there will be both the legs will be affected because both the legs are going to the right atrium. That's one situation. Number 2, suppose this patient is standing whole day. Means suppose this person A, he is a salesman or he is in a cashier job in any supermarket. He's standing whole day. Okay, so 8 hours he has to stand in the counter and do the job. Now every day is going on for 5 years, 10 years, 15 years. So you can see any traffic police or any person who is standing for a whole day, you will see on the back of the leg, his vessels are how the vessels look like. They will be like snake. They will be big, they will be coiled, and you can feel it. Okay, they will be like this. Why? Because they can't. It's against the gravity whole day. It's not. Again, it's pushing the blood against the gravity whole day. It cannot take any more. So this has become what is called. They have become less efficient, and they has become tortuous like a snake. We call it varicose veins. Okay, so varicose veins, and it's painful. And when the blood is going like this, because the veins cannot stand like this against the gravity every day, so you are not taking rest. Okay, so what will happen? The veins will become like this. Instead of horizontal like this, it will become like this. Now it has become like this, so blood is flowing like this. So plenty of time. So when the fluid is moving slow, it is getting plenty of time in the legs. So there is again fluid might escape, causing swelling of the legs. So every time you get a case of swelling of legs, you must look in the heart, or must look at his job, what he do. Is he doing a standing job? That might result in, and remember, this is very painful. We call that varicose veins. This is very painful. So he needs a proper massage and squeezing. You have to release this blood. You have to massage it and squeeze the blood out of these veins towards the heart. Then he'll feel good. Okay. So these are the small things that are related to the cardiovascular system, which you must give attention whenever you receive a patient with one leg swelling. Then it might be a different story. It might be a lymphatic system. But if the two legs are swelled, then it must be heart, because heart receives blood supply from both the legs. So it will not differentiate that one leg is swelled. Yes, today this leg is swelled. Tomorrow this leg will also be affected. It's not one side. It will be bilateral side. Okay. So in that case, we have to know about the cardiovascular system. So that is the importance of knowing the cardiovascular system. So cardiovascular system, we see in that there is the blue is the right side of the heart. So right side of the heart is receiving from two sources, upper half of the body, lower half of the body. And all this blood from right atrium is flowing into the right ventricle. Okay. So this is the right ventricle, and here is the first valve, tricuspid valve. It's a three cusp. That's a tricuspid valve. So sometimes this valve also get defected and it's not allowing the blood to go freely. Then also the same thing can happen. If the valve is weakened, then also it can happen. If the muscle is weakened because of aged, that is called right side heart failure, resulting in this edema. Okay. Remember, here there is liver also. Liver also drains blood from here. So if there is any right heart failure, it is not only impact, there is edema of the legs, the liver will be affected also. Okay. So many, all the organs that are here, which are draining the blood, and it is blocked. So what will happen? All these downward organs will be affected. Okay. So we are coming to this right atrium, to the right tricuspid valve. Then the blood goes to the right ventricle. From the right ventricle, where it goes? It goes to the lungs. Now let's go to the lungs. If you have any questions, okay. So I'll come to that question. Okay, I'll come to your question. Don't worry. So one question is that if the valve presents the backflow. So here, listen guys. This is the right atrium. This is the right ventricle. Okay. So valve presents backflow. Yes, valve is present. Valve is not about valve. Valve is preventing backflow. Yes, valve is preventing backflow. That's not the issue here. That issue here, if blood is not able to empty here. If the blood is not able to empty, then what will happen? Then blood will become more, collect, and it will give back pressure. That is the issue here. So what if okay, good question, Ritika. So what if the person is bedridden? Will they also have the problem of edema? Yes, absolutely. You are very right. If a person is bedridden and have a fracture for 6 months, 5 months, is bedridden. So what will happen? Let's see. So bedridden. Okay, this is his legs, bedridden. And blood has to go here. Now blood is flowing stagnant. Blood is flowing at a free motion. And here is the heart. Okay, here is the heart. Okay, so now here is the heart. Blood has to reach here. So this is not against gravity, but even it needs power from the toes, from the here. It needs some force. Where this force, where this contraction comes from? It comes from the back of the legs. That's why we advise everyone to walk every day. If you will not walk every day, your legs will become pain. Why? Because blood is getting stagnant. It's like a lake now. is like a pool. So blood is not able to move properly at a speed. So blood will become stagnant. It's moving slow. So when it is slow, fluid will go out and it causes edema. That's the problem, and that's why it's painful also. Okay, that's why we need a proper speed. It happens with every fracture patient or patient who is lying down. We must do proper massage time to time and squeezing the blood out. Massage it towards the heart, not in the opposite direction. You have to squeeze the blood towards the heart and empty the vessels. So then it will be better. Or make his leg elevated. Or if the person is, then make his leg elevated. One leg, okay, make his leg elevated. Put a pillow here. Make his leg elevated. Let the blood come out free. Okay, give a proper downhill kind of thing. Alright, so we are going to the now lungs. So this is the left ventricle. Okay, this is the right ventricle, and okay, so blood from here so there is one more valve here, we call that pulmonary valve. This is called pulmonary valve. Okay, this is the number 2 valve. So blood from here is go to the, so this is called pulmonary artery. Pulmonary artery. Remember, this is the only artery which carries deoxygenated blood. Normally when we say artery, it is carrying oxygen, and when we say vein, it is carrying carbon dioxide. So this is the only artery which carries deoxygenated blood, because right side of the heart is receiving all the venous blood, right? Or the blood has more carbon dioxide here. So this pulmonary artery then divides into right and left pulmonary artery, and then it's small branches, and it divides into scattered into branches. Now what is inside the lungs? What is inside the lungs? Let's zoom this part. Let's zoom one part. What is inside the lungs? Inside the lungs there is balloons, okay, which we call as alveoli. We call it alveoli. These are small balloons. That type of balloons, we have almost 1.5 million balloons in each of the lungs. 1.5 million. Each of the balloons are surrounded by blood vessels. Okay, each of the bloods are capillaries. These are pulmonary capillaries. They are small branches. So, and they are alveoli here, surrounding by blood vessels. So you are taking oxygen and you are giving out carbon dioxide. So when the blood moves here, so it gives carbon dioxide from here and it's taking oxygen from here. So the gas exchange, where the gas exchange takes place? The gas exchange takes place at the alveolar levels, in the alveoli. All those 1.5 million alveoli. There is the gas exchange is taking place. Okay, so let me write it clearly. Okay, so right ventricle is pumping the blood out of this lungs through the pulmonary valve, and the blood is going out through the pulmonary artery. This is the left pulmonary artery, right pulmonary artery. Then these arteries will divide it into small branches. We call them as pulmonary capillaries. Okay, small branches are capillaries. These capillaries will go around the alveoli and the gas exchange takes place. Okay, now it has received oxygen here and gave out carbon dioxide. So that the blood was coming this way. So the blood now goes out, is carrying oxygen, right? So it is carrying now all those small branches, carrying oxygen. They will again join together. Okay, and where they will come? They will come to the left side of the heart. Okay, so this is the I just separated the right heart and left heart. So this is the left side of the heart, and they will come okay, they will come. So all this blood are carrying oxygen. So this blue we call it the pulmonary. I just reverse the color, okay, not in your screen. Blue is deoxygenated, so here I just reverse it. Red is deoxygenated, blue is oxygenated. So this, which is carrying oxygenated blood from the lungs back into the left atrium, is called as pulmonary vein. Pulmonary veins. Okay, this is the only vein which is carrying oxygenated blood. So you see, from the right, blood comes to the right atrium, goes to the through the tricuspid valve. So here there is a valve, tricuspid valve. From the right ventricle, blood goes through the pulmonary valve here to the both the lungs. Then the gas exchange takes place. Then gas exchange takes place, and now new fresh blood, which is having oxygen, it drains into the where? Left atrium. There is no valve here. It's directly draining here, left atrium. And from the blood, left atrium will come to the left ventricle through mitral valve. And then heart will pump out again, and it will eject the blood out through the aortic valve. We'll come to that later. Now we are here. Okay, we are in the right side. So you see, from here, through the pulmonary valve, blood is going to the right ventricle to both the lungs. Now let's say this person is a smoker. He smokes cigarettes. Okay, let's say he smokes cigarettes, BH10. Okay, he smokes cigarettes. Now every time he is smoking, where the smoke is going? Smoking is going, right? Where the smoking is going? The smoke is going from his inhaling, okay, and smoking goes this way, is going to his lungs. So smoke is affecting his lungs, right? It's got the nicotine, it's affecting the lungs. It means smoke is affecting the lungs. So every time he's smoking, his 1.5 million alveoli on the both sides, they are damaging, right? So alveoli are damaging with smoke, with every year. Now if the gas exchange don't take place here, just imagine, the gas exchange here is not taking place because this alveoli is damaged by the smoke. Okay, if the gas exchange don't take place, that is our body's natural defense mechanism, that these capillaries will be blocked by automatically, because no point in throwing the blood this side, because this alveoli is not working. That's called constriction. Okay, because of less oxygen or less gas exchange, these blood vessels get blocked. That is our body's natural mechanism that divert, instead of putting the blood to this disease part, divert the blood to the other side. Like it makes a detour. Okay, the blood which is supposed to come here, it will be diverted to the other side. Okay, it's like a detour. I hope you are getting my point. So whenever any alveoli is damaged, those blood vessels surrounding it, they are closed. So let's say he has, because of smoking, he has damaged this part of the alveoli, this part of the lungs. It means what? It means these arteries are also, capillaries are also closed here, right? This is our body's natural. So capillaries are also closed. Right? Now imagine a situation. I am giving a situation here. Look here carefully. Okay. So this is a big. Okay. And then I am making it into small. All right. Now I am closing this one. This one I have closed. This one I have closed. Okay. So blood from here. Let's say blood is flowing this way. And when it is flowing this way, it is going, if it is going to go out, right? And then this one is blocked, this one is blocked, and it is finding a way to go out. Then it's found a way to go out somehow. So will it affect this part or not? Just say yes or no. So if I block two of these branches, so will it affect the main vessels? Yes, thank you. That's it. Okay, yes, obviously it will affect, because blood is coming and blood has to go through 5 ways, suppose, and 3 of them are blocked. Blood is going and hitting everywhere. Then it is finding a way. So it repeated smoking, 5 years of 10 years of smoking. So what will happen? Most of the lungs are damaged. So most of the lungs are damaged. That is also not the issue. That is, yes, that is the issue. It will reduce the stamina, many other things. But the second issue is that most of the blood vessels are being blocked. It is a natural tendency. If gas exchange not take place, capillaries will be blocked. That is called hypoxemic vasoconstriction. We'll come to that. So most of the blood vessels are also blocked. Now heart is pumping, blood is going. Some of the blood vessels are blocked. So obviously it will affect. Like I said, it will affect this part. You have to just imagine this part here in a big situation. So it will affect here. Then blood will be not able to empty completely. From right ventricle, blood is not able to empty completely in the smaller pipes in the lungs. So it will affect what? It will affect the heart. Now in our body, anything we use it more, it becomes hypertrophy, it becomes big in size. Like you go to the gym and every day you are using your biceps will get bigger. That's a normal tendency. So this right heart, in few years, how will it look like? It will look right heart has enlarged in size because of this back pressure. So when a person is smoking, it's not only affecting his lungs, it's also affecting his heart. Right? Now this heart has, normally it is elastic, it is like contracting, it's powerful, it's tight. Now the heart is loose. Will it be able to contract like before? No. It is not able to contract like before. Right? So blood is coming constantly. With every beat, it is receiving blood, but it's not able to empty completely. So what will be the next consequence? Next consequence is the back pressure. Liver will be affected. There will be, what will happen in the legs? There will be swelling. We know why there is swelling, because fluid goes out. It's not able to empty the blood completely because blood is not going out. So blood is not coming here properly because it already has lots of blood already from previous bit. So blood is 5 liters are coming, but 5 liters are not able to empty because 2 liters are already here because it's not able to come empty completely. So there is a huge collection of blood here. Okay, more than it's supposed to be. So fluid will go out, causing edema. So you can see, it can hear from this. The problem started here from the lungs, and it can affect the legs also. So every part of the body is connected. Okay, every part of this body is connected. So we can't say that his legs are swelling because of it. He may be a smoker also. For last 10 years he has smoked, so his legs are swelling. His heart is having problem. His valve is weakened. Okay, valve is affected, or is some liver problems. So any problem related to the which part? The legs will be swelling because legs are the most dependent part of the body. So this is the view of the cardiovascular system. So I'm going to the now left side of the heart. Okay, left heart. So the left heart is receiving so this is the left atrium and this is left ventricle. Okay, left atrium, left ventricle. Okay, and from the left ventricle blood goes from the right side. Okay, it goes from here. Okay. I remove this part now. So the left atrium receives the pulmonary veins, yes, from the lungs. Okay, so this is all oxygenated blood. We call oxygenated blood. Okay, so blood from the now left atrium will go to the left ventricle every beat through this valve called mitral valve. This is called mitral valve. Okay, and from the left ventricle, there is another valve here. This is called aortic valve. This is called aortic valve. So blood from the left ventricle will go to the aorta. This is called aorta, big artery. And then this aorta will go to the from the aorta. We know, we have already studied this is the lower part. You can see from the aorta it comes out and it will becomes smaller and smaller capillaries and goes to the every cells and every tissues, delivering oxygen and nutrition. Right? We know this part. Now let's say blood is coming from the lungs to the left atrium. Now suppose left ventricle has, left heart side of the heart is weakened. Okay. Sometimes some patients have right side heart failure, sometimes some patients have left side heart failure. It depends which side of the heart will be affected. So because of some any cause, because of the valve cause, because of some diseases, left side heart is weakened. Now let's imagine this situation that left side of the heart is not able to empty the blood completely. Okay. So every time the heart is flowing, heart is beating, blood is not able to empty completely. So a little bit of blood is always there. Okay. So right side is okay now. In this person, let's imagine his left side is getting weak. Left side of the heart is weak. So every time the heart is beating, it's not able to complete the blood, empty the blood completely, right? So it's not able to empty the blood completely. So a little bit of blood is always left behind. So every time the blood comes from left atrium to left ventricle, the left atrium will not be able to empty completely because it has a capacity. There is already some blood there. It cannot empty completely. So if it cannot empty completely, so who will be the victimized most? The lungs, because it's coming from the lungs. So if it is not empty completely, from the blood coming from the lungs will not be empty completely. Right? So blood is not able to come in completely. Lungs are not able to, because in the lungs we know, okay. So let me draw a lungs here, big lungs, and this is an alveoli. Okay. Now this is a pulmonary capillary. It's taking oxygen and it is going where? It's going to the left atrium, right? Now left atrium is not able to empty completely, so it will give you a back pressure. So now blood is stagnant here. Then we know whenever the blood decrease the flow or there is stagnation, what will happen? Fluid will leak out. So we say water in the lungs. It's called pulmonary edema. So sometimes patient only comes with cough or shortness of breath, not able to climb the stairs, not getting stamina. Then it's not necessary that he is having disease of lungs. He may be having left side heart failure. So that is connected also. So if there is right side heart failure, you see there is swelling of the legs. If there is left side heart failure, you see there is problem in the breathing, stamina, difficulty in climbing stairs, shortness of breath. Okay, these things can happen. So that's how two lungs or two heart, there, yes, we say two heart today. Right heart, left heart. If right heart is affected, the whole liver, lungs, abdomen, all this will be affected. If left side of the heart is affected, the lungs will be affected. Coughing, shortness of breath, panting, difficulty in finding oxygen, is restless. Again, these things will happen. So that is the concept of cardiovascular system. So that's how when you receive a patient in emergency, you have to know, you have to get a slightest idea at least that what may be happening, what should I do? Okay. Do you have any questions regarding this thing? Okay. Very good. Thank you very much. So that's a concept about cardiovascular system. So when you introduce the cardiovascular system, it's like this. So every part is connected. Okay. Now we come to this part. So what is the valve here? Here is the, we call it aortic valve. The valve here is aortic valve, because this is called aorta. So every time the left side of the heart pumps, blood goes out of the aorta to the different capillaries. Okay, then it gives tissue, glucose, nutrition, and on the way it will give oxygen. And on the way, when they will use this tissues and cells will use oxygen, they will give carbon dioxide. So this carbon dioxide blood will again come this way. So that is the whole circulatory system, cardiovascular system. So if the heart is not pumping well, so if the heart don't pump well, especially the left side of the heart is not pumping well, what will happen? Blood will not go in a proper flow. Now listen here. Blood is, our heart is in the chest, on the left side of the chest. And from the heart, blood has to go out of the heart and reach every corner of the toe, even if to the distant part. I am talking about the distant part of the distant part is our toes. It has to reach from here to here. So heart has to contract in a pressure. If the heart don't contract in a pressure, from here it cannot reach the distant organ of the body. It cannot reach the distant toes. It cannot reach here because it's so far from here to here. It's so far. It's so far that if you don't pump it well, it cannot reach here. Because every part of the body they have a right for same amount of blood or right for oxygen. They need oxygen. Right here. So now it has to put it in a pressure. This blood has to go in a pressure. You have to pump in such a way that it has to go in a pressure. What is that pressure? This pressure is the speed. It is the pressure. Means when the blood goes, it hits the walls. It hits the walls. It goes in a pressure that it hitting the wall. That hit, when it hit the wall, we measure that. We measure that pressure. We call that the blood pressure. So this blood pressure is 120 millimeter of mercury. 120 millimeter of mercury. 120 millimeter of mercury. When we measure it, 120. So when it goes, okay, let's not say mmHg. Let's say, for your understanding, let's say there is a car here. Okay, let's say this is a car. So this car has to go and reach here. So the speed, minimum speed it should take is 120 km per hour. That is the minimum speed it should go out of here. Okay, so at 120 km per hour. So as it is going down, and there are so many branches, so many capillaries. So obviously the speed will decrease when the blood is dividing into so many small canals. From 120 speed will decrease, right? And because every vessel will give resistance, so from here the blood is going into the 3 branches. From another here, this will be again divided into another 3. Again this will be divided into 3. So from the moment here, blood is going out at 120 and it is reaching, it is going, and every time it's going into the branches, the speed is decreasing. So the minimum speed it should maintain to reach every cell and tissue is 80 km per hour. It cannot go below 80, otherwise most of the cells will not reach. That is what we call the blood pressure is, normal blood pressure is 120 by 80. So how to measure the blood pressure, we'll do it in the lab. As soon as the school will open, do it in the lab, don't worry. So when you say normal blood pressure, what is say 120 by 80? 120 is the maximum, 80 is the minimum here at this level. So at 120 millimeter mercury, blood should go out. Then it is flowing at a stable manner. So blood is coming out. It is dividing into 5 branches. Again from 5, it is another going into 10 branches. The speed of the blood is going down and down. But at 80, it should maintain. That is the pressure. If it goes beyond that, most of the tissues or cells will not receive blood. Okay. So that's why you call the normal blood pressure is 120 by 80. We don't say kilometer per hour, or we say millimeter of mercury. Now if we say high blood pressure, what does it mean by high blood pressure? High blood pressure means this car is going at 200 km per hour. Means 200. We measure the blood pressure comes to be 200 by 100. Say for example 200 by 100. Both of them increase. So 200. So high blood pressure is this car is going at a high speed, and there will be one situation one day that it may crash somewhere because it is going at a high speed. So what will happen if this crash? So this vessel may get teared up, and there can be internal oozing of blood or internal bleeding. What we call, and this thing happens mostly where it happens? It happens mostly in the small vessels lying in the brain. So if a person has a high blood pressure, and you see the car is going at a so high speed that it might crash, because it is not usual. Normally this route is made for this speed, 120. Now it is going at a 200. Okay, so what will happen? One day this car will crash, and as a result, these blood vessels have teared and blood has come out. we call it as a stroke. We call that as a stroke. Okay, so blood has come out. Now when the blood comes out, it will bleed, right? It is bleeding, and blood has a tendency of clotting. Every drop of blood, when it goes out, it becomes a clot. So I'll tell you why it becomes clot in the next class. So it becomes a clot, it becomes solid now. Okay, so we call that as a stroke, because where it becomes solid, it will affect. So this portion of the brain has got some functions. Now if there is a stone, you throw a stone there, it will damage that part. So this, if it is damaging the right hand will be paralysis. If it damages the left leg, left hand will be paralysis. So it depends on where the clot is formed, of which part of the brain. Okay, so that's why high blood pressure is risky. Okay, now if the blood pressure is low, let's say the heart is not pumping well, and the blood, his car is an old car, can't go at a speed. Okay, so let's say his maximum speed in this car is 90. It's an old car. Okay, so 90 km/h, this car is somehow moving up, down, and by the time it goes into all the branches, different routes, speed will obviously go down. 90 will become, say, 50. So 90 by 50. So I say below 80 cells, all the cells will not receive good amount of blood. We have billion of cells. Every cell needs oxygen. So most of the cell will be devoid. They will not be getting enough nutrition or oxygen supply. So cells will obviously start dying. So coming to the brain is one of the important part. So brain is not receiving. So can you think this car which is coming at a 90 km/h, can it go uphill to the brain? It's so uphill. From the aorta there is one branch like carotid artery, goes to our neck and goes to here. So heart is here, blood has to go uphill. Can you think that at 90 km/h at this low speed, blood can easily reach? No. Or blood can sufficiently reach? No. Okay, suppose at 90 he is somehow managing. Now the blood pressure has gone down. So let's say 40 by 30. So what will happen if pressure has gone down to 40? Means this car is now traveling at a 40 km/h. Do you think this car can go smoothly to the uphill and then more uphill? No, it can't go. Okay, so obviously the cells and tissues in the brain which needs constant glucose supply, constant oxygen, they will not get enough oxygen and glucose. So just your like your phone or laptop is not properly charged. So what will you feel? You will feel dizzy. You will feel sleepy. You will feel unconscious, or may go to coma. So if the pressure is down, these things can happen. If pressure is high, this thing can happen. If a person is saying, I am having severe headache. Okay, let's imagine. Okay, I am giving a situation here. Okay, let's imagine. Okay, a person A is telling you, I am giving headache. Headache. Is it because of high blood pressure or is it because of low blood pressure? Write your opinion. What do you think? It's because of car going at high speed or car going at low speed? He is having headache here. Okay, headache. Remember, it's a pain in the heart or pain in the head. You will feel pain when the car is going high speed and striking everywhere. High blood pressure. When the pressure goes high, there will be headache because this is the blood vessels, and it is going at high pressure, high speed. This car, so this car will hit everywhere and give you pain. Low pressure is going smoothly, but not at a good speed. So when there is a high pressure, there will be headache. When there is a low pressure, you will feel dizzy. You understand? If your pressure is high, it will give you a lot of pain. Sometimes patients say, I can feel it. I can feel it. It's like top. It is pulsating. It's something like it is about to burst. Because it's flowing so high, and the blood vessels, they are elastic in nature. The blood vessels, every blood vessel, they are elastic. They can expand. They can constrict. Now, because of the high blood pressure, these blood vessels have expanded. It has expanded so much that one day it will burst. It will tear. When it is expanding, it's giving you a headache. Sometimes patient complains of headache and then stroke because it is about to burst. Severe headache, they will say, I can feel it in my forehead. It tap, tap, tap. It's going like this. It's pulsating. It's pulsating because it's coming at high speed. So it's moving everywhere. It is shaking everywhere. It's so high speed. Low pressure is going at low, singing song, taking its own time. Okay, very relaxed, calm and quiet, but not enough oxygen. So there will be no pain, but he may feel unconscious. He may feel dizzy. He may fall down. High pressure. So much of heavy speed car is going inside. You just drive in a high speed car. How will you feel? You will feel restless. You can't focus. Same thing happen when there is a high blood pressure. You will have headache. It will be difficult to give attention. Difficult to focus. You will feel like restless, anxiety. You want to break out. Anything can happen. Okay. So that is the concept of cardiovascular system. I hope you understood.